Hey everyone, I'm Paul Kemmeter. I'm one of the bariatric surgeons here at Grand Health Partners. And one of the questions I get pretty routinely is that people don't understand why it is like, how does bariatric surgery work, but diet and exercise doesn't work in keeping weight off? And I think one of the things that people have to understand when it comes to obesity is actually not about weight. Obesity is a disease where we store too many calories in the form of fat. And our bodies are really good. We have a bunch of mechanisms on the inside that actually we have a set point, and our bodies are trying to keep us at that set point when it comes to calories. So you've heard the concept of calories in, calories out. And what happens when we try diet and exercise, we'll lose calories or weight, if you want to call it that way. But in essence, what we're doing is we're stirring up all the mechanisms that are trying to keep us at our set point. And ultimately what will happen as we're losing calories and weight is that we will drive our metabolism down until we hit a wall. And then once we hit that wall, we're done. We're not going to lose any more weight. The problem is our metabolism is so low at that point that anything that we do, if we don't exercise as much as we did, or if we break our diet, we're going to gain all that weight back. And so what happens is we yo-yo diet, and that's the most common thing that occurs. Most of my patients, actually probably all of my patients, have yo-yo dieted throughout their lives. And what metabolic surgery does that's completely different is it actually interferes with the mechanisms. And that allows that set point to actually slide down to a new set point. And what patients will typically experience will be the complete opposite of a diet. They crave protein over carbohydrates. Sweets usually taste too sweet. They're not hungry all the time. They're not craving food all the time. And weirdly enough, even though they're losing calories and weight, their metabolism actually goes up instead of going down. Now, once the body gets to the new set point, everything reverts back to normal. And at that point, what patients have to do is they have to use proper nutrition, exercise, and follow-up to keep themselves at the new set point. So that's why metabolic surgery is different than diet and exercise. And when we talk about individual surgeries, we'll add on things like restriction. You can't eat as many calories as you normally can. And you can add on malabsorption, where people don't absorb all those calories. But that's kind of the big difference between diet and exercise and metabolic surgery, and hopefully that helps.